The price tag aside, the Democrats' 3.5, 4.3 trillion dollar social spending package, their human infrastructure, has a lot that Americans should be concerned about. In short, House Democrats have taken President Biden's first-term domestic policy priorities and dropped them into one big, gigantic about 2,465 pages. And while some of the items put forth in the bill are clearly concerning, there are some that could be easily overlooked. We've talked about a few of those, about doubling fines for OSHA, which could be the mechanism they go after private companies that do not force vaccinations. But one such point of concern is the health policy agenda, which could be paving the way for a single-payer system for healthcare. I saw this piece that our next guest wrote, and it really clicked for me because I've been wondering, what are they doing with this mandate? They're creating a crisis in healthcare with this vaccine mandate because you're seeing all of these healthcare workers fired. This kind of adds up with what's in this reconciliation bill. Joining me now to talk more about this, Nina Schaefer. She's a senior fellow in health policy at the Heritage Foundation. If you'd like to see her article, it's at tonyperkins.com. Nina, welcome to Washington Watch.
Thanks for having me.
All right, lay out what is in the reconciliation bill that you think will lead us toward, step by step, toward this single-payer government takeover of healthcare.
Well, certainly I think that liberals have learned that talking about single payer or government takeover of healthcare is not very popular with the American people. So what they have been doing is really scaling back the rhetoric on what they're trying to do and really trying to hide their agenda by making policy changes through the reconciliation package. In particular, what's most concerning for me is the creation of a new public option or a government program for certain individuals who live in states whose states did not expand the Medicaid program. Well, that seems very targeted. Oh, we're only looking at a small number of states and a small number of people. But what it really does is it puts in place the building blocks and the infrastructure that is needed to expand government's role and government's control over the healthcare system. And I think over time, the incremental turning of the dial is what's really going to move us to a full-blown government-run healthcare system over time.
So when we talk about a single-payer system, a term that's used out there, we're talking essentially about a government-run healthcare system where the government calls the shots.
Absolutely. The government sets the rules. The government can tilt the rules in their favor, and the government executes what it wants to do. It may have the facade of what people think is of health insurance. There might be a private health insurance banner on top of it, but the person that's really, or the instrument that's really driving what the underlying benefits are is the federal government. And I think that's where policy kind of hits the road on this, because now we are turning our healthcare decisions over to federal policymakers rather than the doctors and patients themselves making healthcare decisions for themselves.
Kind of like what's happening with the vaccine, where the vaccine is mandated and it's not a decision made between a patient and their doctor.
That's right. Centralizing decision-making right out of Washington and then executing what they think is right for us across the board.
So, Nina, a crisis could help expedite this single-payer government takeover of healthcare once the system is in place. And when I read your piece that these building blocks are contained within the reconciliation bill, a light bulb kind of went off trying to figure out, why are they creating this crisis? I mean, we already have a shortage of healthcare workers, shortage of nurses. New York on Monday, 1,400 fired from the largest hospital system in New York. That's just one state that implemented their own mandate. Once the Biden mandate goes out across the country, we're going to be looking at a major, major crisis in our healthcare delivery system.
Well, they think that the solution is just throwing taxpayer money at the problems. They're not learning from any of the mistakes that they have pushed for decades now. And most recently, the push with Obamacare. We're still dealing with the fallout of that, with rising premiums, less access to care. And instead of recognizing what the root causes of the problems in our healthcare system, which is less choice, too much regulation, This administration and this Congress is saying, let's just throw more money at the same problem and we'll just fix it somehow on the back end through government rules and regulations.
Alarming. There's so much packed into this 2,500-page reconciliation bill. It's appropriate we're talking about healthcare. It reminds me of Nancy Pelosi in the first Obamacare bill, where she said we've got to pass it before we know what is in it. I'm grateful that there are those that are combing through this to find all the different red flags that are contained within this legislation. Nina, thanks so much for joining us this evening.
And thanks for having me.